Morning. This time I will discuss about PUFA supplement and COVID-19. Before we talk about PUFA as a potential source for COVID-19 treatment, I would like to explain about lipid first. Lipid is a well-known class of macronutrient that is needed in abundant amount in the human body. That is why we say that lipids are essential. Lipid plays many roles in human body, such as chemical messenger for energy storage in the form of adipose tissue and transporter for fat-soluble nutrient. Fatty acid can be categorized based on the degree of the saturation, means the amount of the extra bond on the structure. Based on the saturation, fatty acid can be classified into three classes: saturated fatty acid, monounsaturated fatty acid, and polyunsaturated fatty acid. Saturated fatty acid can be found in cheese and milk, while monounsaturated fatty acid is often found on avocado, olive oil, almond, and other nuts. Today, we will learn about PUFA and its clinical significance. Basically, PUFA is a type of dietary fat. Polyunsaturated fat is different than saturated fat and trans fat. This unhealthy fat can increase your risk for heart disease and others' health problems. PUFAs can be further subdivided based on the location of the first double bond relative to the methyl terminus of the chain. For example, N-3 and N-6 fatty acids are two of the most biologically significant PUFA classes and have their first double bond on either the third and sixth carbon from the chain terminus respectively. The final carbon in the fatty acid chain is also known as the omega carbon. Hence, the common reference to this fatty acid as omega-3 or omega-6 polyunsaturated fatty acid. Most foods are consisting of combination of all types of fat. Some have higher amount of the healthy fat than others. These are, these are where you can find a PUFA. PUFA can be mostly found in walnut, sunflower seed and oil, flaxseed and oil, trout, salmon, mackerel, soybean oil, and corn oil. You can also get PUFA from any type of commercially available supplement. PUFA, specifically omega-3 and omega-6, has been known for years for reducing cardiovascular disease and have other clinical impact. For omega-3 fatty acid, it can reduce triglyceride level, reduce risk of developing irregular heartbeat, slow the buildup of plaque that can block your arteries, and a slightly lower blood pressure. For omega-6, it may control blood sugar, reduce risk for diabetes, and lower blood pressure. Due to their significant impact, clinicians have been recommended intake of omega-3 and omega-6 supplement far before this pandemic began. Besides that, study shows that PUFA have impact on inflammatory disease, and as we know, COVID-19 can also induce inflammation on our body. Understanding PUFA mechanism toward inflammation can help us to decide whether this compound can be used for COVID-19 treatment faster. PUFA are important mediator of inflammation and acquired immune response, so it has potential to induce anti-inflammatory response. Omega-3 has been known as a cell membrane stabilizer, regulate immune function, block hyperinflammatory reaction, and reduce risk for systemic inflammatory response syndrome. Since as the pandemic began, effort to obtain therapeutic compound and supplement for COVID-19 has been taken place. There are several groups that study about this. Let's see the slide. The first one, the said group found that 1,000 milligram of omega-3 supplementation daily in 14 days it can be say impact the level of these saturated compound. Then Berger group did the case report of successful treatment of symptomatic COVID-19 infection with isopropanethyl, this high purity omega-3. Then Darwes group found that omega-3 PUFA has potential benefit to be used as adjuvant therapy for COVID-19 associated cardiovascular complication. And last, while Pierre group found that omega-3 long-chain PUFA could help improve the resolution of the inflammatory balance in case of cytokine storm in COVID-19 complication. Usage of PUFA to reduce inflammatory effect in COVID-19 patient is also on a clinical trial phase 2 with study type interventional estimate enrollment 40 participants, randomized allocation with primary purpose treatment. The official title of this clinical study is Resolving Inflammatory Storm in COVID-19 patient by omega-3 polyunsaturated fatty acid, a single-blind, randomized, placebo-controlled feasibility study. So, how is recommendation of PUFA intake for COVID-19 patient? First, there are no guidelines for PUFA supplementation usage in treating COVID-19 specifically yet, because further studies are still needed. But American Heart Association recommended consumption at least 500 milligrams a day of omega-3 fatty acid to prevent risk of cardiovascular disease. In recent study for COVID-19 treatment, patients were given 1,000 milligrams omega-3 supplementation daily. Lastly, usage of PUFA supplementation could cause harmful effects. They can make cell membrane phospholipid and triglyceride more susceptible to non-enzymatic oxidation mediated by reactive oxygen species, leading to the formation of potentially toxic oxidation product. So please take this supplement with proper consideration and do not forget to consult your doctor. I think that's my explanation for this time. Thank you.